Thanks for your interest in holistic dentistry and orthopedic orthodontics. We appreciate all the attention that is being brought to the field. Some of the speakers, Dr. Nordstrom, Dr. Broderson, Dr. Hafes, Dr. Lemke, Dr. Bronson, are all very important in terms of what they bring to the table. And today we're going to focus on the K-wire appliance, and we'll also be working with how the body is affected by orthopedic orthodontics in general. And you'll see how seemingly unrelated issues can be helped with these techniques. The presentation that we're embarking on here will be focusing, as I said, on K-wire as a prelude to the ELF. However, the K-wire can be used similar to Dr. Nordstrom's work with the wavy wire in terms of as introductory approach to jaw development for any technique that happens to be utilized by a practitioner, whether it's fixed orthodontics, orthopedic orthodontics, or myofunctional therapy, as well as Dr. John Mew's program of orthotropics. Some of the lecture topics that we'll be working with are overviews of the overall effects of orthopedic orthodontics on a person, whether it be the use of the ALF, orthotropics, myomunchie, K-wires, all of these things, including occlusal composite buildups for proper airway development, are beneficial to the whole person. We're focusing mostly on children here, and the interceptive treatment that can occur between the ages of 3 on up. Not to discount the importance of fetal development nutritionally, as well as myofunctional therapy following a birth. The case that you're going to see on Wyatt is a little bit disconcerting to an orthodontist, because what it shows is following 1 year of treatment, there was an adjustment done to maxillary brackets where chain elastics were used, and I suspect what happened was that the cranial mechanism, cranial bones, the sutures, as well as the temporal bones, the inner ear, the center of the skull, the spinobasal symphysis, were all adversely affected. And following that appointment, Wyatt had trouble walking because of severe dizziness. This new video will demonstrate Wyatt's case as told by his mother. It involves traditional medical care involving 2 hospitalizations plus 2 introductions of massive steroids. And following that, the braces were removed, although there was no improvement seen until we were able to see Wyatt and help him with actually a myomunchie and some cranial therapy.
I don't know how to explain it. I mean, went from a healthy child who was very active to one day couldn't walk. So I don't know how to explain it. It's amazing. I mean, we were very concerned, weren't getting answers, and until we arrived here. On July 5th, Wyatt had an orthodontist adjustment, which he had the braces for a full year. So it wasn't his first adjustment. And immediately after that adjustment, his mouth swelled for about a week when he woke up dizzy. And that made him unable to walk. And so from the 12th on is when he woke up dizzy. And so until one day he couldn't get up and walk safely.
Ella is an example of a patient who has had some serious dyslexia, and as a result of repositioning the mandible, she saw dramatic changes in her ability to record numbers. As you see, the top line is before mandibular repositioning orthotic was created, and the lower line is the corrected numerical sequence that she was able to write. This slide shows the alphabet, and again, it was done prior to the jaw repositioning technique. After the jaw was repositioned with some vinyl spacers, the corrected alphabet is in the second line. The first two images are Jimmy, and the third image is a different patient. Jimmy came to us with slightly crowded deciduous dentition. We suggested a K-wire and occlusal buildups to the parents. The parents didn't think that that was a good treatment. They had a second opinion and decided not to do that. Then they came back 3 years later when Jimmy was 7, and the severity of the situation was considerable. Primary teeth had been crowded out. Permanent teeth were erupting in a haphazard manner, and we did begin treatment at that time. However, it was considerably more difficult. And had Jimmy not done anything at all, then his mouth probably would have shown similar to the third image, which has pretty severe tooth malalignment as well as gingival irritation and poor oral hygiene. As I said, the K-wire can be used prior to almost any form of orthopedic orthodontics, and it's quite easy with experience. There is a learning curve to the construction and to the placement. The wire itself is 0.020 alloy, and it can be constructed and formed by the dentist or by a dental orthodontic lab. There are times when cooperation is an issue, and we sometimes will use anterior impressions where cheek retractors and bite registration material is utilized instead of full mouth arch, full arch impressions and or scanners. As we all know, airway is critical, and the person who has a compromised airway is going to have a number of behavioral problems as well as growth disturbance. So taking that into consideration as early as possible is critical to allow a person to develop to the greatest potential. In this case, the premaxilla has been rotating inferior and posterior. The before slide shows a gummy smile. I know that the two pictures are slightly apples and oranges because the smile is not quite as extensive in the second picture. However, you can see that the upper lip has grown and the overall tension between the nose and the lip has been reduced. This was accomplished through the action of the K-wire as well as occlusal buildups, improving intraoral volume for proper tongue position. This condition is also recognized with the cephalometric before and after X-ray, and we will show the effect of that X-ray, and the before and the after is superimposed in this short video.
Before, after, before, after, before, after, before.
Proper oxygenation is critical to proper body function, proper brain function. Roger Price taught me about capnography and the importance of measuring oxygen and CO2 and achieving proper balance for that. Tongue posture, tongue function, jaw development, body development, appropriate growth patterns, posture of the overall body, mouth breathing, nitric oxide concentration, production, improved athletic ability, craniosacral function are all connected to proper jaw relationship and proper tongue function. This slide illustrates, as a previous slide did, there is a connection between the brain and the body. Moishe Feldenkrais talked about the Feldenkrais technique, and what he speaks about is that there's a brain-body connection and as well as a body-brain connection. There's the feedback, it goes both ways. And in this case, what's demonstrated is that with jaw position, you get improved brain-body connection. And as a result, dyslexia is improved, as well as a number of other body functions. My previous statement is accentuated by the present slide. Kalia had a great deal of difficulty playing hockey and other sports, as well as handwriting. And she was referred by her grandma, a physical therapist, and as a result of starting some orthopedic orthodontics, her ability to play hockey and other sports was greatly improved. Marcella's case is similar also, because all sorts of improvements in school and extracurricular activities occurred as her craniosacral system and orthopedic orthodontics was improved. As dentists, we don't think about the correlation between bedwetting, night terrors, mouth breathing, stuttering, but this patient, Sarah, definitely saw great improvements in those areas. This is one of my favorite slides because it summarizes so many of the cases that have had great improvements as a result of orthopedic orthodontics. And it's so satisfying to be able to review some of these pictures and cases. It means a lot, and each one of us in the dental profession has the ability to alter children's lives with these techniques. This is a picture of Denise when she was very small. At this time, she had crowded teeth, and her dentist removed several permanent teeth. As a result, her mouth did not develop, and other parts of her psyche did not develop either. She was able to become a mother, and she had, I believe, 5 children. However, her life was not as full as it could have been. Denise's ALF appliance is on the left, and her 11-year-old son, Keith, has an ALF appliance on the right. It just illustrates the difference in the jaw form and the importance of jaw growth that results from keeping teeth and utilizing teeth and doing jaw development as well as cranial balancing. As with Denise's case, it's extremely important to keep baby teeth until they are replaced by permanent teeth. Permanent teeth have a matrix to follow, and that matrix is the baby teeth. If there's crowding present in the deciduous dentition, we need to intervene with everything that we have available in our armamentarium. Oftentimes, if baby teeth are removed, it's like robbing Peter to pay Paul. It interferes with premaxillary growth, airway development, as well as jaw posture and the ability of the cranial mechanism to function and brain fluid to flow. These are the reasons that we see some of the dysfunctions in children and adult as they come to our practice. Premaxillary development allows proper nasal breathing, proper endocrine function. Along with that, nitric oxide is improved in its production through healthy tissue that surrounds the sinuses as well as the nasal passages. Nitric oxide is also known as endothelial relaxing factor, and it's important in lowering blood pressure and getting proper oxygenation to the whole body. I think that K-wires and orthopedic orthodontics are so important. It's an extremely beneficial method for correcting issues that we see with our children. The blue mousse impression that is discussed here is one of the ways that we can register the form, the arch form, from a facial standpoint without causing undue stress to a young child by taking upper and lower impressions. Sometimes even a scanning technique is difficult on young children. So the use of the blue mousse impression or any other quick setting bite registration material is easy to use. This slide shows before, during, and after jaw development through the use of the K-wire. As you can see, the activation of the K-wire itself allows for improved jaw development and reduction of crowding through the adjustment of the omega loop in the center. The next step is for us to show you a video that includes the ease of impression using the bite registration material, building up the vertical to improve oral volume, and also the placement of the K-wire. In Asher's case, cooperation was extremely difficult, as is quite evident in the video because he bit me 2 or 3 times. And the change in his behavior between the initial behavior problem and about 20 minutes later, after I did occlusal composite addition of about 1.5 millimeters, was dramatic. His improved cooperation level and his attitude was considerable. It still wasn't very easy to put the K-wires on, but it was improved a lot. And then after we got the K-wires finished, he also showed us considerable improvement. So this is something that I'm always surprised at, and I don't know why I'm surprised because it happens almost every time. But we're going to see that video now. The K-wire was developed by Dr. Katzev in St. Louis, and he found that by bonding onto the primary cuspids, he was able to get arch development, which improved airway, throat function, as well as the ability of the body to resist overall stress. We'll also be doing occlusal buildups to improve oral volume and airway function prior to the placement of the K-wires. So we make use of the tremendous root of the primary cuspids with the K-wire to create the cranial development necessary for proper health. I use bite registration material and cheek retractors to capture the cuspid to cuspid facial aspect of the upper and lower jaws. And this allows me to get the K-wire constructed properly without causing undue stress to the individual because of airway dysfunction. That's another reason that we use the occlusal composite, is to increase oral volume and improve cooperation level of the child. Starting at the age of 3 or 4 years of age is sometimes necessary because of the need to reduce the overall fight or flight mechanism that is present within the children. Asher's using his lip to give him a little more vertical. And so some people will put their tongue between their teeth, and sometimes people will bite on their lower lip to bring the jaw forward to help open airway. So first we're going to clean off your teeth, and then we're going to put some bonding on. Open really big.
Remember, open big and hold still. Just some water. Not very much even. Just a whistle. The sound it makes when it's working hard.
Well, we'll probably have to skip the etching and go to the bonding,
Yep.
and then the flowable. Sure, don't move. Normally I etch, bond, and then I put composite on, but because of the tongue release and the myofunctional therapy that was supposed to have been done didn't get done, so we're having to skip some steps here.
You're doing great. Just a little bit longer. Breathing in that belly.
Good job. Now bite, open. Open,
Stay open.
close, bite, open, close, open, close, open.
You're doing great. Holding still. Keep holding still. Breathing in your belly. You're doing great.
So we're adding about 1.5 millimeters vertical here. And it's going to be fine. I'll modify it later after we get better cooperation.
Open big.
Okay, now tap your teeth up and down. Which side hits first? This side or this side? This side? Okay. Open again. Tap your teeth up and down. Which side hits first? Okay. Okay. Bite down. Open. Bite. Bite. Open. So you can see that the width of the central is about 6 millimeters, and it came in, but we're going to have a little bit of space problem for the rest of the teeth. So that's one of the reasons that we want to widen the jaws. So this is how the K-wire comes. Yeah. It's designed with the handle on the right because I'm right-handed, and so generally I will make a little bit of a bend to that handle. Hold your tongue real still. So this is the etching, and first I roughened the tooth a little bit with a diamond to help the bonding. We really don't want this bonding to come off.
Keep your tongue back.
So this is heliobond, and then we're going to set the heliobond. Hold your tongue real still. I leave a little bit of a projection of the heliomolar, and then I place it.
Ow!
Hold real still.
Nice and still. You got it.
Cure.
You're doing great. We're setting that material.
This is triad clear flowable, and I will reinforce the bonding around the margins.
Hold real still.
I have a half of a cotton roll, and in hopes of keeping the area dry, because if you can't keep it dry, then you can't get your bond. Good job, Asher. Hold real still. Look at those pictures up there.
And we don't cure this time.
Right? I'll hold it and you can put it on.
Ready?
Yeah. That's good. Hold real still.
Ready? Ready?
Okay.
And again, I wait till he's ready in position.
We're going to remove the handle.
The wire itself is about 1 millimeter from the gum tissue, and adjustments
done? Not quite.
adjustments are done on the omega loop. A very small amount of adjustment is done on all 3 of those spots, and that will help start the activation. Now, sometimes if I think that there may be an issue with the lip or cooperation, I will sometimes start an elevation of the premaxilla by adjusting the, okay, close. That's it. Hold it just like that. I'll make a little bit of an adjustment on the omega loop on the right and left side, which will elevate the front part of the K-wire. And you can see that if I were to adjust the omega loop here, it lifts up this end here. If I make an adjustment here, then it lowers that cuspid. So for every little adjustment that's done, there's major effects. And the purpose of the K-wire is to increase the cuspid width. And so you can see that if we ended up with a straight omega, then the cuspids will be further apart. So it's a pretty simple principle. And the trick is to not over adjust in order to elevate the premaxilla. And if I anticipate a cooperation problem, that will help give stability to the K-wire. So in Asher's case, I think I will do that. Open really big. Oftentimes when mouth breathing occurs, the premaxilla grows down and posterior, and that's a problem. Okay, I'm going to smooth this a little bit. Does it feel a little different?
Yeah.
Yeah.
I like it. Can I take this off now?
How
Okay.
does the wire feel?
Good.
Good?
I can do this.
Do the buildup on the lower teeth first is to help increase oral volume, which helps the airway, which helps the cooperation level. In this K-wire, we've got the omegas slanting slightly toward the front, because I anticipate I will need a class 3 elastics at some point to propel that maxilla forward a little bit more. And so the class 3 elastics will hook around the omega loops. That's why they're angled in that direction.
Yeah, just to hold that mirror. I can. Still like a statue, like you're frozen. Okay. Hold still. Nice and still.
Okay, here. Now, because this K-wire was made a little bit ago, the mouth has changed some, and
Ow!
sorry, Asher. So I have to modify the size by adjusting the omega loop. Hold real still.
Nice and still. Good breathing.
Here,
I don't have enough light, so shield.
it's okay.
No worries.
Remove the handle again.
So you can see the design of the lower
Can you smile for us?
and the angulation of the wire. And so again, I'm not going to activate right now, but if I were to, I would give a little bit of a squeeze on the lower part of the omega, and then a little bit of a squeeze here and here. So those are the three spots that are adjusted. Asher wants his jaw forward, but his upper jaw is holding it back. So that's one of the reasons we want to bring that upper forward and widen everything. So,
Later than cut this.
can you give me a high five? Good job. The process that you've seen with the K-wire has been something that I have been practicing for over 30 years, and I have found it to be extremely beneficial for patients. The satisfaction that you get out of using K-wires, as well as all the orthopedic orthodontic techniques that you have at your disposal, is extremely beneficial for our patient population, and the word needs to get out that these are techniques that can really improve the life of our patients, as well as all those associated with the patients, including parents and other siblings and the general population. So that video illustrates the changes that can occur with airway improvement as well as cranial freedom. Brain fluid flow and jaw development is greatly assisted by these techniques. One of the effects of the K-wire, as well as Dr. Nordstrom's wavy wire, is that it helps to improve premaxillary growth. There's a lip bumper effect from it, as well as jaw development. Tight lips can restrict the overall forward development of the maxilla as well as the mandible. Lip closure is also an important factor, as overcontraction of the lips are eliminated as an impediment to growth and development. So as summary, airway is extremely important. Jaw development is related to behavior issues. One of the things in my practice that I notice is that when we lay a patient back in a supine position, the airway is negatively affected. If we do the jaw development properly in the children, that negative effect is eliminated. If we can help our children grow and develop properly, it will mean all the difference in the world to their overall life, as well as the life of their parents and everyone that they come in contact with. You saw some interesting cases, some before and after situations that were pretty dramatic, and they are able to, I think, identify why dentistry and medicine need to take a look at the relationship between structure and function. And in the case of Wyatt and some of the facial developments that were shown, as well as behavioral changes, overall body development, athletics, sports, all of these areas are greatly altered. And from an early age, starting at 3, we see some unbelievable changes, including a foot drop with a 2-year-old who couldn't walk. And the myomunchie is huge. The K-wires are extremely important. And some of the books that I really appreciate is Lip Zip. That's a fabulous book to purchase and either give or sell to your patients. Primal Dentistry, Carol Vandestep is a fabulous author. And James Nestor's Breath is huge. This is one of the most entertaining books in my library, and it's extremely important to utilize, not only for us personally, but also for our patients. So thank you for your attention, and I hope that you're able to incorporate some of these philosophies and ideas.